Hello guys, do you know that hypertension or high blood pressure has no symptoms in many cases? It is known as the silent killer because there are no symptoms, despite its role in highly increasing the risk for heart disease and stroke. Untreated high blood pressure considered the second largest number of preventable heart disease and stroke deaths, second only for smoking in general. Okay, guys, let's go more on depth regarding hypertension. Blood pressure is defined as the ratio of the systolic blood pressure, which is the pressure that blood applies on the arterial walls when the heart contracts. And the diastolic blood pressure is the pressure when the heart relaxes. Hypertension or high blood pressure is constant elevated blood pressure that can be measured by a sphygmomanometer. Hypertension prevalence is extremely high in the United States. However, not all hypertensive people need medication. In fact, nearly one-third of people who have high blood pressure don't know it. The degree of damage in the organ system is directly associated with both systolic and diastolic blood pressure. It is important to know that blood pressure must measure on at least 2 or 3 readings and in at least 2 separate visits before a diagnosis is made. The best way to know if your blood pressure is high is through regular checkup. You can also monitor your blood pressure at home with the help of a reliable digital sphygmomanometer. New categories of hypertension, which is very important and is updated in November 2017 by American Heart Association, is in normal people, less than 120 millimeter for systolic, over 80 millimeter for diastolic. In elevated form, between 120 to 129 millimeter for systolic and less than 80 millimeter for diastolic. Stage 1 hypertension is between 130 to 139 millimeter for systolic and between 80 to 89 millimeter for diastolic. And stage 2 hypertension is systolic at least 140 and diastolic at least 90 millimeter. And finally, the last stage could be a hypertensive crisis, is defined as 180 over 120, which means doctor needs to change the medication or immediate hospitalization is needed if there are signs and symptoms in patients. It is important to know that dangerous side effects of hypertension start when your blood pressure is in stage 1. Now I want to talk about the symptoms of high blood pressure. In mild to moderate types of hypertension, there are no symptoms, but you should know about some symptoms which could be present in the severe form of hypertension and consider a medical emergency. The first symptoms could be a severe headaches. The other one is nose bleeding. Third is fatigue or confusion. The fourth is vision problems. The fifth is chest pain. The sixth is difficulty breathing. The seventh is irregular heartbeats or palpitation. The eighth is blood in the urine, and the last one is pounding in your chest, neck, or ears. So guys, it is very important if your blood pressure is 180 or 120 or higher and you have one of these symptoms, take a rest for 5 minutes and check again. If your blood pressure is still high, it is a medical emergency and call 911. Here I want to talk about risk factors that contribute to high blood pressure. There is a strong association between body mass and blood pressure and between obesity and hypertension. In general, the risk appears greatest in people who gain weight during the third and fourth decades of life, and usually the weight loss by obese hypertensive people is associated with a reduction in blood pressure, especially during active weight loss. So I highly recommend people with hypertension doing weight loss as soon as possible, especially at younger age. Second is advancing age could be a contributor to high blood pressure. Genetic factors and certain genes may make people susceptible to hypertension. Other one is the consumption of table salt is associated with high blood pressure, especially in black people. Other one is low potassium diet is associated with hypertension. Stress also is an important factor associated with high blood pressure. In industrialized countries, there is a higher rate of both systolic and diastolic blood pressure compared to less developed countries. And hypertension is more common among blacks or African origin than in Caucasians. Okay, guys, we enter the end of the first part of hypertension. If you have any question, leave a comment below. Make sure to like and subscribe so you could be able to watch my future video. Thank you for watching and being careful about your health.